I always go back to like chronic rhinitis because so many people have it. And I'm like, are we all just inflamed and dripping phlegm? And that doesn't seem like it's okay that I feel kind of sick all the time. That feels like my body is a little bit on high alert all the time. That can't be good. Um, uh,
It's a good point, but I have to jump on what you say there. So this is why it's so important to have friends in other medical specialties, right? Who do I have on speed dial? I have the GI docs on speed dial. I have the allergy immunologists on speed dial. I have infectious disease on speed dial, right? And the allergy immunologist, that's one fellowship. It's called Allergy and Immunology, and it's grouped that way for a reason, right? Because the immune system can tweak in either direction. They need to be familiar with all of them. And so, yeah, when somebody tells me, "Oh, I have chronic rhinitis," okay, then the questions that an allergist immunologist might begin to ask are, do you also have eczema? Do you have itching? Do you have asthma? If you don't have it, does somebody in your family have it, right? Because what we're trained to do in medicine is get a phenotype, sort of get a story, do pattern recognition, right? And so is this a patient in front of us who has all those things in what we would call atopic disease? Or do you just have one piece and not the others, which is also now we're going in a different direction. Okay. Do you have chronic rhinitis because you're always having a sinus infection, or so I mean, at the end of the day, for all the fancy technologies we have, I just sit and ask my patients question after question after question, and they will tell you what direction to go every single time.
so let's talk about the trial. Tell me a little bit about the trial and why it's important, what the approach is when people get encephalitis.
Yeah, so we're currently running what's called the Extinguish trial for NMDA receptor encephalitis. I am so excited about this. I eat, sleep, and breathe this trial. Literally, we have a 24-hour hotline for the trial, so I eat, sleep, and breathe it. This is sponsored by NINDS of the National Institutes of Health, and we now have all of our sites activated and enrolling. So it's 37 sites in the US, 2 European sites, Barcelona and Rotterdam. And we need to do that because this is a rare disease. It's for NMDA receptor encephalitis. We have no approved treatments for any type of autoimmune encephalitis, none. And NMDA receptor encephalitis being the most common type of autoimmune encephalitis, that's why we're studying that one.
Let's talk about what the approach of the trial is. Like, what are we doing in the trial?
All right.
Why that's different than what
Okay.
is done before people get into the trial?
Yeah.
Okay.
In the Extinguish trial, we're trying to accomplish so much for the patients and the condition in one trial. We are testing one medication that we think works well, but we don't know because there are no approved treatments. But we are also trying to learn so much about these patients. So we are talking to their loved ones, finding out the caregiver experience. We are following the NMDA patients long term to understand their cognitive recovery, to understand their mood and depression and anxiety and all the things that might obviously come with an illness like this. We are collecting blood markers and creating a repository so that in the future we can go back and say, you ended up with a really severe manifestation, whereas the next person had it mildly. Can we look at the blood and might we in the future be able to predict who's going to have it severely and who's going to have a more mild case? So much going on with the trial. But for these patients, we've known about NMDA receptor encephalitis for 20 years now. Joseph Dalmau and his colleagues described the condition, identified. It's been 20 years since Joseph Dalmau and his colleagues identified NMDA receptor encephalitis and that the receptor was the target. And in 20 years, we do not have any approved treatments. We are still doing what we think's best, but without high quality data to inform that. And so the trial is aiming to finally bring this to the patients. I think, it's a question that comes up when we approach these families, because it's the families. The patients are too ill to have the discussion at the time we can offer the trial. And the loved ones are overwhelmed, right? Someone who was previously healthy is now in the hospital, in many cases in the intensive care unit. And they say, I don't know, there's a lot going on. I don't know about a trial. Um, but it's so important because we cannot answer any of their questions. They say, why did this happen? What is the best treatment? How long is recovery going to take? And we don't know. And so that's the conversation I usually have,